Good morning from California, and welcome to the ATS SRN American Thoracic Society Sleep and Respiratory Neurobiology Assembly 360 webinar reviewing high-impact sleep medicine publications from the past year. I'm Dr. Chana Chin from CHOC Children, soon to be Rady's Children's Health in Orange, California, and will be moderating today's session in conjunction with my colleague Dr. Bradon Nokes at the University of California, San Diego. I would like to thank our listeners for joining us. We will review 5 following papers: Sultiame once a day in obstructive sleep apnea flow, a multicenter randomized double-blind placebo-controlled dose-finding phase 2 trial, mitochondrial origins of the pressure to sleep, Tirzepatide for the treatment of obstructive sleep apnea and obesity, Tirzepatide on obstructive sleep apnea related cardiometabolic risk, secondary outcomes of the SURMOUNT-OSA randomized trial, effect of obesity on sleep apnea pathogenesis differs in women versus men, multiple mediation analyses in the retrospective SNOOzZE cohort. Our esteemed authors will present their papers, followed by a 5-minute question and answer session after. We encourage our audience to ask questions in the chat and will attempt to address each question as time permits. Without further ado, we will start our first paper, Sultiame once per day in obstructive sleep apnea flow, a multicenter randomized double-blind placebo-controlled dose-finding phase 2 trial, presented by Dr. Kosh Stenloff.
Thank you. So thank you, Chana, for giving us the opportunity to present this paper that we published last year in Lancet in October. And it is the publication of the flow study with the title Sultiame once per day in obstructive sleep apnea, multicenter randomized double-blind placebo-controlled dose-finding phase 2 trial. So I will go through a bit of the results, and then after we will have questions. So these are my disclosures. And the background for this study is, as you know, that carbonic anhydrase is a prevalent enzyme in several isoforms in the human body that maintains a normal acid-base balance. And we know that modified carbonic anhydrase activity may be a pathophysiological mechanism in sleep apnea. And in the past, we have managed to publish one paper evaluating the carbonic anhydrase inhibitor Sultiame, where we saw quite consistently that it reduced sleep apnea activity in this proof of concept trial. Next slide, please. So the study I will present for you is then a multicenter double-blind dose-finding study where we used treatment for 15 weeks and 3 different dosages of Sultiame. And in the study, we used in-lab polysomnography and vital signs and biochemical assessments for evaluation of the efficacy and safety. In addition, we also used a number of different prompts, including SUCLI, the SQI, and ESS. Next slide, please. So the design of the study was set up so it included 33 study centers across Europe in 5 different countries. And in total, we had 298 patients randomized. And the study included first 4 weeks of screening period, followed by 3 weeks of titration, 200, 200 or 300 milligrams of Sultiame. And then we also added a follow-up period of 2 weeks. Next slide, please. So the characteristics for the study population was set up so we think that the population represented quite good the tentative OSA target that we consider for the treatment. And there were basically no clinical relevant differences between the different treatment arms with a BMI, a mean BMI of 29 and a mean HI of 29. Next slide, please. So moving forward to the results section, as you can see here from this slide, there was quite a pronounced effect on the reduction in AHI. Looking at the AHI-4, it was up to 47% in the 300 milligram group. And here it was also important to see that the effect we observed in the 200-300 milligram range was similar in both moderate and severe OSA. Next slide, please. Looking at the oxygen values here presented with the ODI and the mean O2 set, We saw a clear decrease in ODI and an increase in mean SAT with approximately 1% in the 200 and 300 milligram groups. Next slide, please. What about sleep quality? We saw quite a significant improvement in sleep fragmentation, here demonstrated with the arousal index, with a reduction quite clearly in both the 200 and 300 milligram group. Apart from that, there was no clinical relevant reduction of the REM sleep in either group, and the total sleep time and sleep efficacy increased significantly. Next slide. And as I mentioned, we had a number of different promising included. The values that were significantly changed was when we looked into the ESS score. And as you can see on the left side, there was a decrease in all groups. And if we looked specifically in the group with an ESS with 11 or more, there was a quite improvement in the 200 group with a reduction of more than 3 points. So next slide, please. So apart from the sleep variables and oxygen values, there was also a favorable cardiovascular profile demonstrated in the study with a reduction in blood pressure and a significant change in the 200 milligram dose regarding the systolic blood pressure. And apart from this, we also saw a positive metabolic effect. Next slide, please. And this slide shows responder analysis that we also performed as part of the report in the paper. And this slide shows the number of patients achieving more than a 50% reduction in HI or reaching a value of less than 15 events per hour or both. And as you can see in the 200 and the 300 milligram dose, it was close to 50% of the study population that reached its target. So next slide. So moving on to the side effect and side effect profile. And the side effects that we observed were in line with the known safety profile of Sultiame. And the frequency was clearly dose dependent, and it was as expected, and it included as with the most frequent side effects, with paresthesias, headache, dyspnea, and nausea. And paresthesia being the most frequently reported adverse events, it was defined as intermittent, mainly mild, and restricted to fingertips. Next slide, please. So sum up the paper, we found that Sultiame reduced the apnea index by a mean of up to 47% and was associated with improved oxygenation. Sultiame led to a reduction in excessive daytime sleepiness. It improved overall sleep quality, and we believe that it demonstrated a favorable cardiovascular and metabolic profile and was well tolerated by the patients. So overall, we think that Sultiame represents a promising and novel candidate for the pharmacological treatment of obstructive sleep apnea. Thank you.